Have you noticed that some days your Vyvanse works well, but then on other days not so well? It might be something that you're doing in your diet. Hi guys, I'm Dr. Kidd, a doctor in Australia that's prescribed Vyvanse over 1,000 times, and in this video, I'm going to give you 4 dietary tips you must know about to make sure you're getting the most out of your Vyvanse. First tip is to avoid an excessive amount of acidic food. Studies demonstrate that acidic urine significantly increases the excretion of amphetamines. The active ingredient in Vyvanse is lisdexamfetamine, so it's an amphetamine-based substance. Some studies show that acidifying urine can increase amphetamine elimination by 48 to 75%. When consuming acidic foods or drinks, this can make your urine more acidic or a lower pH, and this can lead to your amphetamines being eliminated faster out of the body. What this means practically is that your medication may wear off sooner than you would expect. So what are acidic foods? This includes citrus fruits and juices such as oranges, lemons, and grapefruit, high-dose vitamin C supplementation, as vitamin C is ascorbic acid, soda and energy drinks, and vinegar-based foods. Now you don't have to remove all of these foods completely, and what I see clinically in my patients is that the overall impact is probably small unless you're having a large amount of acidic foods. There would also be certain things on the list that I would recommend removing before the others. For example, I generally recommend reducing soda and energy drinks first because they have a lot of artificial flavors, colors, and preservatives and are generally unhealthy for you. While I generally wouldn't recommend removing fruits such as oranges and lemons as they have a lot of water content, a lot of nutrients and vitamins that are generally healthy for you. Vitamin C, which is ascorbic acid, is another interesting one. Vitamin C are typically seen used either to prevent illnesses or to take with iron to increase its absorption. So if you're taking vitamin C to prevent recurrent illnesses, the efficacy of this is probably low anyway. So if you're having trouble with your Vyvanse effectiveness, then it's probably best to stop the vitamin C altogether. However, if you really need the vitamin C, for example, absorbing iron better, it's best to take the vitamin C at nighttime away from your Vyvanse. That way it won't affect its excretion and your Vyvanse is already worn off anyway. Tip number 2, make sure you have some protein at breakfast. This one I'd like to dive a little bit into and help you understand the theory versus the reality of it. There are many people on the internet right now that recommend having protein with your Vyvanse to improve its efficacy. This is because protein is broken down into amino acids, and one of those amino acids is tyrosine. Tyrosine is an important precursor to dopamine, and this is the chemical we're trying to increase in the brain with Vyvanse. So logically, ensuring that there is enough of this would appear important. However, in reality, it's unlikely the body will get to the point where it doesn't have enough tyrosine to make dopamine, and it can get protein from your muscles. Additionally, there are no studies to date that back that protein intake increases Vyvanse effectiveness. Now, having protein in your diet is generally not a bad thing. Certainly, if you're vegetarian, don't like meat, or Vyvanse suppresses your appetite a lot, it would be a good idea to get some protein in at breakfast so you have enough for your day. Some examples of good protein sources for breakfast include eggs, smoked salmon, and Greek yogurt. So overall, protein probably has little impact overall on the Vyvanse efficacy, but it may be a good idea to try and have protein in the morning anyway because Vyvanse can suppress appetite, and if you're someone that doesn't eat, protein is a very important macronutrient that we should have in a healthy diet anyway. Now, just a quick reminder before the next tip, if you're finding this video helpful, please like and subscribe to the channel. I know you guys have another 3 tabs open already, so subscribe now before you forget. Tip number 3, ensure good hydration. This one might seem obvious, but the science behind it is really important to understand. First, stimulant medications like Vyvanse activate your sympathetic nervous system. This is your flight and fight system. This will cause dry mouth, increased sweating, and decreased thirst signals. You might not even feel thirsty even though you're dehydrated. Why this is important is that research has shown that even mild dehydration can cause impacts on executive function, attention, and memory. A 2011 study found that even minor dehydration at only 1.59% of body weight impaired cognitive performance. So you're taking medication to try and improve your attention and focus, but if you're dehydrated, then you're working against yourself. It's like you're trying to drive a car, but you've got the parking brake on. So what is enough hydration? Well, for most people on a typical day, 2 to 3 liters, which is about 8 to 12 cups of water, should usually suffice. You may need more if you're doing an intense exercise and you're sweating a lot. Now, if you struggle to remember to drink enough water, here are some practical tips. Keep a large visible water bottle on your desk, set some phone reminders, and pair drinking water with existing habits such as bathroom breaks or before a meeting. Tip number 4, strategic meal timing with your Vyvanse. This is about optimizing when you eat, not just what you eat, and this is backed by FDA pharmacokinetic data. FDA studies demonstrate that taking Vyvanse with food, particularly high-fat meals, can delay the peak concentration by about 1 hour, taking it from 3.8 hours on an empty stomach to 4.7 hours with food. The total amount absorbed, however, remains roughly the same. This gives you 2 strategic approaches. Option 1, take Vyvanse with breakfast. The pros of this option are that you get a smoother, more sustained effect, you can eat before appetite suppression, and you get less stomach upset. The disadvantage of this option is that it may take 60 to 90 minutes to notice a reasonable effect. Taking Vyvanse with breakfast may be best for patients that don't have much to do in the morning and need that longer sustained effect and don't want too much stomach side effects. The second option is to take it on an empty stomach and don't eat until 30 to 60 minutes later. Benefits of this option is the faster onset of action and stronger initial effects. The downsides of this option is that the Vyvanse might not last as long, you may forget to eat, and you might get slightly more stomach side effects. This option is probably better for people with a lot of early morning obligations, tolerate the medication very well, and have a quieter afternoon. So whether you take Vyvanse with breakfast is really dependent on your personal situation, and you can tailor it towards your specific situation. So in summary, 4 dietary tips to improve the effectiveness of Vyvanse include avoiding excessive acidic foods, ensuring good hydration, ensuring adequate protein, and timing your meals strategically. Another important lifestyle measure to optimize symptoms of ADHD is making sure you have good sleep. If you'd like, check out this video here on 10 tips to improve your sleep with ADHD, and I'll see you in the next video.